As the number of novel coronavirus cases continues to rise nationwide, the recurring message from many public health experts and doctors has been simple: wearing masks saves lives. We are not defenseless against COVID-19, Robert Redfield, director of the Centers for Disease Control and Prevention, said in July. Cloth face coverings are one of the most powerful weapons we have to slow and stop the spread of the virus, particularly when used universally within a community setting. But as face coverings have become increasingly commonplace in American life, so have questions about efficacy, and now a group of researchers from Duke University are aiming to provide some answers. In a recently published study, the researchers unveiled a simple method to evaluate the effectiveness of various types of masks, analyzing more than a dozen different facial coverings ranging from hospital-grade N95 respirators to bandanas. Of the 14 masks and other coverings tested, the study found that some easily accessible cotton cloth masks are about as effective as standard surgical masks, while popular alternatives such as neck gaiters made of thin, stretchy material may be worse than not wearing a mask at all. "You can really see the mask is doing something," said one of the study's co-authors, Warren S. Warren, a professor of physics, chemistry, radiology and biomedical engineering at Duke. "There's a lot of controversy and people say, well, masks don't do anything. Well, the answer is some don't, but most do." The search for a way to determine the effectiveness of different masks began with a request from a professor at Duke's Medical School who was working to provide at-risk and underserved populations in Durham, NC, with the critical face coverings, according to a news release from the university. Faced with so many varieties of masks all claiming to have virus-blocking capabilities, the professor sought help in the university's physics department. Enter Martin Fischer, a chemist and physicist. Using a simple contraption that harnesses the power of a laser, which can be easily purchased online for less than $200, and a cell phone camera, Fischer created a device that allowed his team to track individual particles released from a person's mouth when they are speaking. The rest of the setup includes a box that can be made out of cardboard and a lens. "It's very straightforward, doesn't take much resources," Fischer said in a video produced by Duke. "Any research lab has these things lying around." Testing the face coverings was equally uncomplicated, according to the study published Friday in Science Advances, a peer-reviewed journal. Speakers said the same phrase into the box without a mask and then repeated the process while wearing one. Each face covering was tested 10 times. Inside the device, the airborne particles passed through a sheet of light created by the laser hitting the lens and produced visible flashes that were recorded by the phone's camera.